Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, Matt Holson with Sanford Health News talks with Fred Pitzel, administrator in Olathe, Kansas, and Angela Prevost, director of nursing in Ottumwa, Iowa, on the topic of preventing leader burnout.
I have Fred Pitzel, administrator for the Good Samaritan Society in Olathe, Kansas, and Angela Prevost, a nursing director for the society in Ottumwa, Iowa. We're talking about leader burnout. Do each of you have personal experiences with burnout?
Matt, I can truly say that I have not. I've been very thankful for the role I've been able to play within the society, really seeing the mission that we have, and I think that's really has kept me from that whole area of burnout. So I'm very thankful for that. That sense of purpose has really helped out.
Angela, have you had any experience? How'd you deal with it?
Yes, unfortunately, I have experienced burnout being in the manager position for 22 years. Emotionally, physically, I've experienced burnout.
What are some of the common signs you look for when it comes to burnout?
I think sometimes when I've experienced burnout, I might get mood changes, I might lose sleep.
How does that affect you in your day-to-day?
It makes my attitude not as good as it should be. I like to maintain a positive attitude. And when I start feeling myself go down that negative road, I have to find ways to cope.
Are there common signs you look for with your team, Fred?
Absolutely. Something we're always looking out for is we want people to be engaged at work. So some of the things you're going to see is, people just not having the energy for the job, maybe not having the same passion that they once did, not taking pride in their work. That's something that we would look for. Becoming cynical. That's something I try to catch myself too. That could be a step towards burnout. Then maybe you're just exhausted as we're talking about, exhausted emotionally, you're spent at the end of the day. Those are things that we would see.
Are there specific resources you and your team has in place to help people avoid or recover from burnout?
I would say the most important thing is to use your PTO. We are afforded a lot of time that we can use because sometimes people either fill us or they drain us. And when they start to drain you more than they fill you, I think it's time for us to take a break. We need a break from them. They need a break from us. I think that's very important that we do that. Also, within Sanford Good Sam, we have our volunteer time off as well. We can use that. That's 8 hours is given to us as employees, and that's a great time to focus on others when we're doing that.
Explain that a little bit. What is volunteer time off?
So the volunteer time off is a new initiative. It started a couple of years ago. So if you're a full-time employee, you get 8 hours to volunteer whatever organization of your choice, and you serve there. You're representing this the society. You're representing Sanford. If you're a part-time employee, I believe it's 4 hours that you're allowed to give.
It's a great program. Angela, let's go back to the resources available. You're in charge of a number of nurses. What is there for them if they're struggling? What can be done?
Well, I always encourage them to talk to their manager. Of course, that's why I need to stay 100% all the time. But I also encourage them to reach out to peers that they can trust, find a friend at work, somebody that they can safely, vent their feelings to. When
it comes to recovering, maybe avoiding too, do you kind of align with Fred there too? Use your PTO, take a break.
Yes.
What do you think about that?
Work-life balance is extremely important. And I think as leaders that we sometimes forget that because our nature is to just work. And we have to remind ourselves that that is important.
It's a different industry because there's a resident at the end there and you want to be there for the resident. Is that kind of why people are pushing themselves so hard?
I think people truly care, and when they care so much they don't take time away, that can impede with what they're doing. So I think we just have to give people permission to take time off and to step away. That's going to help them in the long run. We have in our industry we have so many regulations that we're under. There's a myriad of them, and we just have to make sure that we are doing what's right by the residents. We're also going to make sure we're taking care of our employees, that they get the time away so they can better care for the residents that we're called to serve.
Is that stressful to have all of that hanging over your head?
Yes, that's very stressful, but that's why you need a team. You can't take it all on yourself. You have to really spread out what we're doing. We've got a very important mission, and we're called to share God's love through the work of health, healing, and comfort. It takes all of us in the building to make that happen. And I always align people's work to the mission. If you're a cook, if you're a person who's hanging pictures, if you're a person cleaning your room, you are helping us live out that mission.
Angela, are there changes in the industry you'd like to see to better support leaders and reduce burnout?
I guess the changes I would like to see are maybe tools that we can give our staff to be mindful and aware of the signs of burnout and what to do about it.
The advocacy that's going on with Good Samaritan Society in Washington, D.C. is amazing because there's so many different regulations that are trying to come down upon us right now. There's a staffing mandate. So I think just continuing to have that advocacy out there is so important for us. So those are things that we'd like to see happen so we can care for our residents, care for our staff, so they can care for our residents.
Angela, you were putting your hand up again. Do you have something to add?
Yes, just teaching also healthy ways to take care of yourself by getting enough rest, promoting exercise, eating right, because I feel like sometimes as healthcare workers, we don't take good care of ourselves and we end up showing up to work, tired or things like that.
And there's a lot of resources with our own company here, with wellness, with well-being, that we have the opportunity to take advantage of. And those are things I encourage anyone who's a Good Sam Sanford employee to look at what's available within Inside Sanford. Also look at the Sanford Leader. There's opportunities for you to become a better leader, which I think is going to help you avoid burnout. If you're focused on the right things with our residents, there's a lot of different opportunities for us out there as leaders.
Rely on that support. I think that's great advice. Thank you, too, for joining us here on this important topic.
Thank you, Matt.
Thank you, Matt.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.